Do so. All right. Well, good morning again, and welcome. We are so glad that you're able to make it to Care Farming Network's member gathering for August. Today's session is titled Evaluating for Impact, Tools for Measuring Success. And we're thrilled to be offering it as an encore presentation from our 2025 Care Farming Network National Conference, where it was a really well-attended and highly rated session. So we know that terms like outcome versus output or qualitative versus quantitative can feel very confusing and sometimes overwhelming. So you're not alone if you're here today because you want more information on what exactly evaluating for impact is all about. This session is meant to be practical, a bit hands-on, and we're going to walk through the what, why, and how of evaluating programs, specifically in a care farming context. So you might be new to this. You could be here to just strengthen your care farm's programming. But today our intention is to introduce you to the definitions, tools, and strategies that will help you to understand how to measure impact, tell a compelling story with some data, and build a stronger case for both funding and stakeholder support. So we'll leave about 20 minutes at the end of our meeting today for Q&A and group discussion. So please, as always, feel free to drop your questions in the chat throughout, and we'll get to those after our presenters. Also, if you have an evaluation practice or a tool that you've used on your care farm or in your work, we would love and encourage you to share those in the chat during our discussion and presentation today. We are going to make this presentation accessible after the session, so the slides and shared resources will be emailed to you and available on CFN's website. I just wanted to also say a big thank you to our presenters for sharing their time and their expertise today. And first up, I'm pleased to introduce Dr. Tony Watt, who's professor of sociology at Texas State University, who brings a wealth of experience in evaluating community-based mental health programs and supporting care farm research. So Tony, take it away.
Sure. Hi. Good morning, everybody. Thank you for attending this session to talk about evaluation. As you heard, I'm Tony Watt. I work at Texas State University, which is just a little bit outside of Austin. My career for a very long time has focused on teaching and doing research on mental health, and specifically doing evaluation research of programs and policies aimed at improving mental health for populations that have experienced trauma, like children in the foster care system, but other populations as well that have mental health disorders or substance abuse disorders. Throughout a lot of that work, I've become really interested in alternative interventions that use nature or food or community to try to improve mental health. And so when I learned about care farming, which really has all of those things, I was so excited, but I am new to care farming. Although the university about 2 years ago created a student-led regenerative farm, and I'm working with an agriculture professor to try to pilot test that farm as a care farm for our students, maybe the community. So I'm really excited to connect with the network so I can learn more about what you're doing with care farming, understand what it is, and then also because my entire career has really focused a lot on evaluation, to try to share with you a bit about evaluation methods and maybe how we can work together to build an evidence base for care farming. So today, what I want to cover in the talk is a little bit of why should you even do evaluation. I know you're really busy with the work you do, and why add something on top of it, and then how to approach it, particularly if you're new to evaluation. So the whys are, in my opinion, first and foremost, as a feedback loop for you, so that you can begin to understand what is it that you're doing that's working, that's producing the outcomes that you desire to have, and what might be missing the mark. Where can you course correct? Where can you refine? So that ultimately over time you can, and maybe your programs are already perfect, which would be great, or maybe they can use some refinement over time. And then when you get where you have the outcomes that you know you should be able to achieve, that you're able to document that. and that you can share that with funding agencies and make yourself more competitive for funding, and that hopefully we can work together to disseminate it more broadly, maybe in academic publications or press releases, so that the whole movement can move forward. So I'm a big believer in the value of evaluation. Now, if you're going to start, I think the first place I would start and typically do is by creating a logic model. And I understand, and that's why I'm going to go quickly through this part, that Kara is going to share with you an example of a logic model, which is really cool. But logic models are nothing more than a visual representation of what you're trying to do, what you're planning to do, and what you hope to accomplish. It looks a bit like this. It's a one-pager. You read it chronologically from left to right. It sort of talks about what resources do you start with, what activities you're going to engage in, who are you going to serve, and how do you hope to improve your clients or participants through these activities. Funding agencies love logic models. It also helps you clarify what you're trying to do internally, and sometimes funders require them either in a proposal or in a grant report. Here's an example of a logic model. And again, you're going to see more of this from a real functioning care farm. So I'll go quickly here. But this is an example of a logic model we put together for the care farm at Texas State called Bobcat Farm, because we're the Bobcats. And you can just see sort of what inputs are, the resources you start with. Those columns that have the green heading and say outputs are, again, what are you proposing to do? How are you going to implement the program? And traditionally, this is what most people reported on in their grant reports as an evaluation. But we call this a process evaluation. It's very, very important to say, did you do what you were planning to do? And most evaluations include this. For example, if you were going to have 100 volunteers, did you have that many? But then now funding agencies really want the next piece, the pink or red boxes, which are, if you did offer these activities, did you improve the lives of the people that you're serving in some way? What are the outcomes associated with your work? And so that's why in the next slide, sort of clarifying terminology, that's why we refer to evaluations often as process and outcome evaluations. And these are just examples of what you would look at for process and what you would look at for outcome. Today, I know most people are pretty comfortable with process, documenting what you're doing, but people might be newer to measuring outcomes. So I'm going to spend most of my time talking about that. Now, there are different kinds of data sources you can use to measure outcomes, qualitative and quantitative. Jackie's going to talk to you more about that, so I'll go quickly through this. Basically, qualitative is more detailed. Quantitative is a larger sample, but quantified results. I always think it's best to do what we call mixed methods, which is combining different data sources. So you do what we call triangulate, which is come at the issue from multiple angles to get a holistic picture of what's going on. But Jackie's going to talk to you more about that. I'll talk a little bit more about outcome data and how to gather it and interpret it. These boxes on the left, as you'll see, get at some of the concepts that you might consider for what kinds of outcomes might you want to measure. On the right are simply how would you capture that information, maybe existing scales or surveys, because you don't want to reinvent the wheel. You don't have to make up how to gather these data. A lot of these are already existing surveys you could use or existing measures you could use. Jackie's going to talk to you about how to find some of them, and I'm going to share some examples with you as well. But one of the most important things I think to clarify here is you do not have to measure all of these things, and please don't. The logic model is for you to decide and clarify, what are you trying to do? Who are you trying to serve? And what do you hope they'll gain from your program? It might be that your program focuses on job skill development, and that's really what you're doing. If so, then that's really what you should measure. At the conference, there was a great presenter that talked about the potential of using a depression scale as an outcome measure called the PHQ-9. As you see, I've got it here. I think it's a fantastic measure. I'm going to show it to you. I use it all the time. But again, that would only be appropriate if you were working with populations that have depression. So again, take a look at some of these outcome measures and make sure you choose something that's relevant for what you are trying to do and who you are serving. And I would start with even just one, maybe one or two, but even one would be great. So let's talk a little bit about those measures. Here is an example of the PHQ-9, which is a depression screener. I'm going to go through some different kind of surveys and questions real fast because I don't have a lot of time and I really want to make sure everybody else has their time. But I just wanted you to at a glance see what these actual questions look like. And then you can, dig into them in more detail once you get the PowerPoint or ask me more about them later. And I can send you these surveys too. But the PHQ-9 is a 9-item question. Oop, and it's not showing up. So the 9th question is not there, but you'll see it later. So you can see that it's a pretty simple structure. You ask people, how often have you been feeling this way? You simply record in the boxes which answer they picked, and then I can send you a guide for how to interpret it. You just add up the scores. There's a threshold that will tell you if the person has a score of this level or this high, it's likely they have a clinical level of depression. And then you can just track over time, either the total score when they start beginning to work with you and maybe at some follow-up period where you think maybe they would be improving. And then you just see, are they less likely to have depression at a later date or are their scores lower? But as you look at this, you can see some of these questions are pretty personal. And the 9th item is a suicidal ideation question. So you really don't want to ask this, again, unless you're prepared to go into this topic, unless it seems appropriate for the population that you serve. So let's see, I think I'm having, how do I get there? The next one. Okay. So maybe you want something more general. This is what's called a perceived stress scale. It's just a 4-item questionnaire that captures stress. And these are some things that you could ask because more of us experience stress. You could just take a quick look at that. There is no cut point for this necessarily or threshold. And then moving on quickly, maybe you don't want to be as deficit focused as depression or stress. Maybe you want to look at personal growth or development. This is an example of a youth development scale. It's for youth, but I mean, it really, I think, could apply to adults. I would love to feel more confident too over time. I'd love to be more confident in social situations, including presenting in front of people, which after 30 years still feels nerve-wracking, or to, have more of a sense of purpose. So these are just some things you could consider. Another scale that I have just become really interested in is the Watts Connectedness Scale. And I talked about this in January. It is a scale that, and it's not something I created, that's just coincidence. It's a scale that captures connection to self, connection to others, and connection to the world. And the connection to the world domain includes questions about connection to nature. So this might be something that many care farms are seeking to change or improve, and it might be relevant to you. These are just a sample of some of the questions, and I can send you the whole scale, or you could pull from it. Now, again, getting back to making sure that what you want to capture and what questions you ask or what measures you use are appropriate to the clients that you serve or the participants you serve. Many care farms serve populations with intellectual and developmental disabilities, and there's a really great summary article that I can send you that talks about or just summarizes what are the scales or instruments for capturing quality of life for individuals with IDD, and that some client bases might have an IDD, a group of people with IDD where some of the previous scales would not be appropriate, or the questions might be too complex or too intrusive. And so some scales that exist include something as simple as a question asking from very sad to very happy, which number from 0 to 10 best represents how you're feeling right now. Or you could even have these drawings and ask some of your participants, which drawing best captures how you're feeling today or the last few weeks. And then you can look at that from a follow-up period of time. So I can send you that article that talks about the different options for individuals with IDD. But those are just some examples of different surveys. The one thing I want to get at that I think is a little more gnarly, a little bit more research nerdy, but then I'll be done with that and we can move on, is to talk about if you're going to measure an outcome over time and look to see if there's change, which that's the main thing you want to do, is have some sort of baseline when people first come to you, and then some logical follow-up period where you think maybe participating in care farming has improved something for them over time. Ideally, you would have a comparison group, but we're not going to go there. I think if you can just start with a pre-post measure for your clients or participants, that you're going to be doing a tremendous job of like at least being able to track outcomes, and grant funders will love it. But if you watch whether people change over time, the question you have to ask yourself in the end is, if there was change over time, how do I interpret it? So for example, if I come in and I have a depression score of 11, and then after 3 months, I have a depression score of 10, my score is lower, but have I improved? Honestly, that's not really a meaningful change. If you are a practitioner, you'll know that 1 point change is something maybe I wouldn't even notice. It's not going to change my quality of life, but it's lower. Or what if your entire population has an average score of 11, and then at post, it's a score of 10? Is that good or bad? I've found that most organizations doing evaluation have absolutely no guidance on how to interpret change that happens. Now, when you are looking at change over time, researchers, particularly academic researchers, will often do a test for statistical significance. Is the change statistically significant? Some of you might have heard of that term, some of you might not, but in research that gets published, it's really kind of the thing that everybody looks for. But the problem is, I don't think a lot of people really understand what that test is doing. It requires a lot of training. It requires more sophisticated statistical software. But all it's telling you is not that the change is important or meaningful. It's just telling you if the change is real, meaning it's not an artifact of random error or random fluctuation in a measure that's likely to occur. For example, my mood changes day to day, right? My blood pressure changes, my blood sugar, my cholesterol. But if I have two tests and there's a difference, it doesn't always mean it's real. It's just random kind of noise in there, as we call it. So the statistical tests are trying to figure that out. They are really good at detecting significant change when you have a large sample, but it's really hard to find significant change when you have a small sample. And most care farmers are going to be dealing with small samples. So you've already disadvantaged yourself to start. All of that, if that's just sort of was way too much to ingest, the point is don't let people tell you that you have to find statistical significance, or you have to have some expert with all this statistical knowledge to find out if you have change. In evaluation, what we argue for instead is the calculation of something called an effect size. An effect size is nothing more than it is a statistic, but it's a really simple statistic that any layperson can calculate and interpret. All it means is, if you look at the people you serve on average at the pre-test, and you look at them on average at the post-test, did they change, and by how much? Was it a change at all? And if so, was it a small, medium, or a large change? And you'll see the statistic is called Cohen's d. And I've given you some of this kind of nitty gritty stuff here about, if you have a change that is at a 0.2, then that means you do have change. You do have a small change. So that's a good start. Anything less means it's probably not even a real change. If you hit 0.5, that means you have a medium change. That's pretty good. If you hit 0.8 or higher, that means you're having a pretty large change, and that's really exciting. Now, the way to do that can be done with just an Excel spreadsheet. So I'm giving you an example. This is the last kind of really detailed slide of a spreadsheet where, if you'll see, this is not depression or some of the other measures, it's GPA, grade point average, for a sample of 5 participants. I've got their GPA at the pre-level, at baseline, at post, after an intervention. I've created a formula in Excel that'll just calculate the means and standard deviations and then use that to create this Cohen's d measure. And as you can see, Cohen's d is highlighted in yellow. For this group, they had a mean GPA 2.354 at baseline, 2.718 at post-test. You can see this in here. That comes to a Cohen's d of 0.948 and something something. If you go back to the previous slide where you see if Cohen's d is 0.8 or higher, that's a large change. I have 0.9 something. So what I can say is, wow, GPA improved. It was a large change. And that's something you can do just with this spreadsheet. It's easy to say, it's easy to write in a grant report, and people can understand it. So I can even send you this spreadsheet where you just take out these people and enter in your pre and post test, and it'll just calculate it for you, whatever you're looking at. So it can be simple and it doesn't have to be intimidating. And finally, you also can look at other ways. I'll go through this quickly. Data visualization with charts and graphs. People can do that too. So it doesn't always have to be Cohen's d. But in general, I don't want to take up too much time. I just wanted to introduce you to some ideas about how to interpret change, since most people aren't quite sure how to do it. And that can give you something grounded in research and literature. But just to wrap up, I want to encourage you to create a culture of evaluation, first of all, by getting a little training in how it works yourself, which you're already doing today. There's lots of YouTube videos and how to do it too. You can learn a lot that way. You also might want to connect locally with professors or students at universities who are studying research or evaluation. Many of them might want to help you for student projects, for classes, or a practicum or thesis. You could also try to hire an external evaluator. It's really expensive to hire an evaluator to do it for you, but you could hire one as a coach to help you learn to do it yourself, just with a little consulting fee if you have some grant money. There's the American Evaluation Association. You can go on, click on your state and search for an evaluator. You can talk to me. We can talk about maybe how to do that. But I just hope that you'll continue to be interested in evaluation. Use it for your own feedback loop. It can really be a morale builder internally to get to document what you know is happening positive and to share that with other people. So that's it for me. If you have any questions, let me know. Hopefully I didn't eat into too much time for the other presenters. Thank you.
Thank you, Tony. That was fantastic.
Am I now messing up by not knowing how to stop sharing?
No, but let's see.
Let's see what we can do. I just clicked off something. I don't want you to see on my messy desktop too.
Right at the bottom of your screen, you should see a green
Oh,
arrow.
I see. I got it.
There you go.
Oh, what a awkward way to end. Can't figure it out. Thank you.
Hey, not a problem. Seriously, that was good stuff. Thank you. Um, Lots of good questions already in chat. Please feel free to keep them coming. For now, though, I would like to welcome Jackie Farrell, an occupational therapist and adjunct faculty at Boston University.
Thank you. I'm just figuring out, I think I'm going to try to share my whole screen.
All right.
All right, let's see how this works. So what I'm going to do is I'm going to share some slides and then go through a website that shows how to find some of these outcomes. So that's why I want to share this way, but let's, can you just see the PowerPoint?
Looks great.
Okay, great. So hi everybody. Like Kate said, I'm an occupational therapist and a home hobby gardener. I've worked in community-based mental health for almost 7 years and really have yeah, just really found that there's a need, and I think I know I'm preaching to the choir here, but there's really a need for additional, like, kind of out of the box ways to support people with various conditions. I've personally seen it in the mental health space that we need more like creative and nature-based ways to support people, but I think it applies in a lot of different groups. And some of the things I mentioned, Tony did a nice job of kind of setting me up where we're going, but want to start with a little bit of well, this is a large excerpt, but I'm going to pull out some pieces about going back to why program evaluation is important. You likely feel like it's important and that's why you're here. But just to kind of validate you and maybe your feelings, this is a quote from a systematic review of care farming that was done a while ago in 2018, but it essentially outlined some of the challenges with being able to advocate for and show the value of care farming as it's come up in research. Some of the challenges with really being able to show and say that care farming is effective is smaller studies, sample numbers, um, addressing people from various different groups or populations, um, using unvalidated outcome measures, so using measures that aren't already existing out there that has less validity to them, and sometimes not really having follow-up periods or just missing key outcomes. So you can see that these are some areas that we can really address by talking about how to better collect outcomes. Um, reiterating a bit of what Tony had shared. So why we're looking at program outcomes to really determine, is your care farming effective for your community? What are the benefits? And to really be able to share that both with your community, with yourself, so that you can further improve your program and offering, and also externally, whether it's just for advocacy or for funding, like Tony had mentioned. So lots of reasons why this is important. Some things, if you're just brand new into thinking about collecting outcomes, some questions you could ask yourself might be, what outcomes are you interested in learning about? Or put another way, what do you want to know about your care farm? You might have some inkling of people are coming and they seem happier, or people are coming and I notice over time they're talking to each other more, or they're having less difficulty learning new things, like that's getting easier for them. So kind of, if you're really not sure where to begin, I think just taking a moment or a few moments to really just think about, what is your care farm really doing and what are you interested in learning more about? And then secondarily, thinking about, who are these outcomes for? So do you want to tell other people who might come to the care farm as a participant what they could expect? Do you want to advocate to other care farmers about the great work that you're doing and kind of really be able to share everything that you're doing in an effective way? And also, again, coming back to the funding sources, I think a lot of people here are likely in that boat where you're having to look for funding sources, you're having to really prove what you know is working. So I think that's a really big area, but knowing who your audience is can help you figure out what questions to be asking and what outcomes to be looking at. Because there might be common things that people want to know, but there might be different things that a participant might be interested in versus someone looking to award funding to your program. And then Tony started to talk a little bit about this, so I'll spend some time here. We have different kinds of outcome data. Generally, we can split them into two types of data: quantitative data and qualitative data. Quantitative data, you can think about quantity as kind of part of the name there. This is numerical data. It can be collected many different ways, but the data itself is numbers. So it's kind of asking like how many or how much. Some sample questions I have here, but going back to Tony was giving the example of depression score changes. So if you fill out that depression questionnaire, you're getting a numerical score, and it's something that you could compare, before someone started at the farm or day one at the farm versus 6 months later. With that, um, going back to statistical analysis, when we have numbers, that's when we can use all of these methods to show that things are statistically significant or to calculate that effect size. Qualitative data, so you can think a bit about like quality, or the question of like, what qualities are going on here. This is non-numerical data. This can be opinions, experiences, and it's kind of getting at the question of how and why is care farming effective? This type of data can also be collected many different ways. It could be in a written survey, an interview, um, testimonials, and there's many different things that you can do with qualitative data. But this, I think, for me, really brings the numbers, the quantitative data, bring the statistical analysis, make it feel like more research robust. And the qualitative data kind of brings like the human experience in. And like Tony had said, doing mixed methods, so having both, can really just show from both ends the effectiveness of your program. And also just want to mention with testimonials, so with qualitative data or any type of like a quote or things that people share, if you're doing some sort of grant funding, you might share like a quote from somebody that really explains the value they're getting from the farm. You can also, partnering likely with a researcher for this, but you can also do some coding of your qualitative data, so of your language-based data, and come up with different themes based on what people say. So you might do something like people are reporting, what are they getting out of care farming? And then you might see themes pop up. So people might say like, I made more friends. It's easy to talk to people. Um, I met somebody new. And so you might take from that, there's a theme of improved social participation. So there's ways to kind of categorize that as well. And then how to collect data. So like I mentioned, there's many different ways to collect data. And as you're thinking about what you want to address, what you want to know as outcomes, and also thinking about the real life implications of adding in some data collection, that's going to help you decide how you might collect data. Some things that you want to consider is how long it's going to take to do this because you're all busy, but also depending on who you want to fill out this form, you want to make sure, or whatever data you're coming up with, you want to make sure that it's a good fit for how long it's going to take and their cognitive level to do so. On that same note, considering like reading level, um, vision, making sure they can see clearly. If English isn't their first language, is there, a version of a form in a different language? So doing your best to make it accessible to people and a good fit. And also thinking about where and when you might complete some measures. So something you might do is having people fill out a form or a brief questionnaire before they start coming to the care farm, and maybe when they leave, or if your groups don't really leave, which is great, it might be 3 months later and then 6 months later. So thinking about how often you might want to collect data, and also considering, is there a time of day when people are more motivated or more alert that you really feel like you'll get the best representation of whatever they're reporting? So this table, there's a lot here, but I'll just kind of share a little bit here of some of the pros and cons of different types of data, and this will help you decide what type of data you might use. So for example, a survey, either a written survey or an online survey, I think are a really great way to start collecting data because you can get data from a larger number of people. You can have numerical data in there as well as qualitative data. Um, and you can have people fill this out independently or maybe help if needed. But the so those are all the benefits. The challenges is you're not really able to gather additional information because it's a set survey with set questions. Whereas on the flip side, if you decided you wanted to get more of that further information and really dig in and ask follow-up questions, you might decide to do an interview, which is going to take more time. But on the flip side, you're getting a more personalized approach and you can really dig in and get more information. So there's no right or wrong with what type of data that you're going to collect, but thinking about the benefits and the pros and cons can help hopefully narrow down what you want to collect and what's going to be the most feasible for you, for your farm, and also for the members or participants. This is another slide similar to what Tony had shared about potential outcomes that you might measure. So I won't go through all of these, but you'll have this as a resource of things that you could, jumping off points. And this is definitely not an exhaustive list, but a way to get thinking about some outcomes. There's also a lovely infographic on the Care Farming website that breaks down benefits of care farming into different categories. So connection to nature, social, physical health, mental health. So you can also, like Tony said, don't reinvent the wheel. Think about what other care farms are already doing or what the existing research is already starting to say about the benefits, and then maybe building on that for your farm. So there's some of this is repetition, but what I want to go into next is some examples of how to find some measures with a really great free resource. But just want to mention again, like Tony said, reach out to other people, local universities, students, different fields may have an interest in supporting your mission and figuring out either they can maybe just recommend an assessment to you, or maybe they're more deeply involved. It, depends on your interest and their availability. But there's a lot of free resources to create surveys online. So Google Forms is a great one, SurveyMonkey. Also, Microsoft has forms if you're already using like Microsoft platforms. But you don't pay to create a survey. There's lots of free ways that you can do that. And then the next thing I want to share is, I'm going to try to go to my website. Let's see. Kate, can you see the website now?
You sure can.
Okay, great. So the next thing I want to share is a free resource through Shirley Ryan Ability Lab, which is a really great rehab hospital, I believe, in the Chicago area. But they have an online free database where you can search different outcome measures. What I really like about this, and just a warning, I'm going to be doing a little bit of scrolling. So if that isn't working for you visually, I'll try to tell you when I'm going to scroll and not, but just know that that's coming. So I'm going to scroll a little bit, but you can see here that you can filter for different types of assessment. So if you want to have a patient reported outcome, or basically like people reporting about themselves versus an observational report, you can filter here. You can also filter for the area of assessment, so what category of assessment you want to look at. Body structure, you probably won't need that filter, but it exists. And then on the far right, population. So they have, I'm going to scroll again, many different populations. So if you're working with people in a certain group, you might find them here, but also more general, like mental health, mixed conditions, non-patient is another good one, and other. So I'm going to scroll up again, and I'm done scrolling. I'm going to put in a couple examples just so you can see how this works, and then please play around with this on your own and see what you come up with. But the first thing I'm going to do is, what you can also do is, oh, let me pause there. We're going to do this first. So the first thing I'm going to do is I'm going to say I'm really looking for an area of assessment that looks at mental functioning. So I'm going to go to area of assessment, mental functions. And for now, with any type of searching, start broad and then narrow it down. If you picked something in every category, it might not come up with anything. So we're just going to start with one filter, and then we're going to search. And you can see it's come up with 125 results that are looking at mental functioning. So that's a lot to sift through. Now I'm going to say, okay, let's think about patient-reported outcomes. So this is another word for like self-report measures where people are reporting on their own experience. So I'm going to check that. And now we have 64 results. So a little bit, a little bit more manageable to look through. What you can do then is this first one here, we'll just use this as an example. You can click the measure and you can see even before you open it, it's telling you how long it takes to complete, 10 to 30 minutes, and the cost. So we're always looking for free as a, as a way to begin. I always look for free. Then when we look, I'm going to scroll again. When we look into it more, it's giving us more details. So this satisfaction measure looks at life as a whole, self-care, contact with friends, vocational, and on. What's great is that a large portion of the measures you find here, you are actually able to download directly. So this one, I'll just show you briefly. I just click download. And then it gives you the measure. So really great way. If you see something you like, you can, 8 times out of 10, maybe just get the measure directly through here if it's free. This also lets you look at the full measure and really say, are these things that make sense for me to ask about? Does this measure make sense? And get a little bit of a sense of how it's organized. So that is one example. Another thing I want to show, so I'm going to go back and just start at the beginning.
Jackie, this is Kate here.
Yeah.
We still have Kara and a
Oh,
little bit of
yes.
time. And so if
Okay.
at all possible, just know I will be including resources and sheets. So sorry, but I
Perfect.
just want to
No,
make sure.
that's okay. I just want to show one more thing and then I'll wrap up here. The other thing I just wanted to share is that you can, let me give an example. Areas. So if I want to look at activities and participation, and then I'm going to go to patient reported outcomes. I did this earlier. I just want to show one example of what else you can see about the measure, kind of going back to what Tony was sharing. Okay, this might not want to load for me in time, but what I wanted to just say about this is if you scroll down even more, it will also give you some information about statistical significance and something called the MCID, so minimum change essentially. For self-report measures, it will say a change of 8 points means a significant change. So you can get some of that information directly in here as well. All right, sorry about that. I don't know why it's not loading. But yeah, happy to answer questions, and definitely if you use that, feel free to reach out and we can try to problem solve and find a measure that might work for you as well. All right.
Thank you, Jackie.
Thank you.
I love the free tools. I know we talked about this session before, and so rest assured, everyone, those tools are coming your way. Kara, you were going to share with us the logic model that Red Wiggler uses, and Kara is the executive director at Red Wiggler Care Farm. So we just asked you to walk us through a real world example of a logic model to help bring everything that we've discussed so far kind of into focus there.
Yeah, absolutely. So as Tony sort of introduced the concept, logic models are a way to sort of visually represent a program. So I'm going to share Red Wigglers. We last did an update in 2023. The caveat that I'm going to say is logic models have been really useful to us. We were kind of forced into doing one first for our first USDA grant, probably in like 2007, 2008. And since then have come back to them to update them. That being said, they don't do all the work. There's still a lot of work that needs to be done to take what you say you're going to measure and figure out how you're going to measure it. So as I walk through, I'll show you some of the areas that we are still figuring out how we're actually going to measure. And we're actually doing work right now around intended impact. We've talked a lot about the importance of outcomes and evaluation for funding and for sort of proving the case of care farming. But one of the things that we're all really focused on is, are we having the impact that we intend to have on our participants? And ultimately, if we have that, then we have the story to tell, then we have the data to back it up. So I'm really trying to, as the person writing the grants, it's hard to do sometimes, but really trying to make sure we're focusing on the actual impact that we're having on the individuals we serve. So let me share our current logic models. So just even the same color scheme that Tony showed here. We have our program description. So this is for our grower program. The grower program employs adults with disabilities on the farm. We have the program goal, and then we have our inputs, which is all of the staff and the infrastructure. We then have the activities. So for this particular program, the activities that are going into it, the outputs, and this is really where we still hang our hat a lot, is on sort of the output numbers. And what I want to move us towards is this outcome reporting. So you'll see we have an X here. X% will accomplish individual goals. So we still have a lot of opportunity to define how we are actually measuring these things. So this is a great first step, but there is more work to do. Just quickly looking at a different example, this is our CSA, which actually just rebranded to our Harvest Share program. And so the goal here is that 50% of our yield is distributed to low-income households. And again, we still focus a lot in reporting these outputs and are still working towards how we report on the actual outcomes. So we'll share this out, and I'm also happy to share the revisions as we go through. There's one for all of our programs. So that was service learning, which is volunteering, education, and then finally the care farming network. So you can see how they all fit together. We're really fortunate that in Montgomery County, Maryland, where Red Wiggler is located, we have a great nonprofit organization that hosts this program called MORE. They sometimes do it virtually, so I'm going to link to that so that you all have access to it. Also going to link to the consultant at Sharp Insight who runs the MORE program that does work across the country. And then finally, a consultant, operational consultant we're working with. Her name is Lee from KiteString. And she's really helping us focus on our intended impact. And the benefit, if you decide to work with her, is she's already got the care farming kind of understanding. And I'm happy to make connections if anyone would find that helpful. So more to come. This was obviously really fast, but it was perfect timing because we're really diving into these right now as the season theoretically winds down and going into the winter.
Thanks, Kara. And Jackie and Tony. We have about 10 minutes left. There's a couple questions in the chat that I'd love to revisit. Particularly, let's see, Isabel from Smile Farms was asking, she wanted to learn maybe a little bit more about the IDD quality of life measures. You had mentioned that, Tony.
Mm-hmm. Yes, and I think the quickest thing would be just to make that summary article that was like a meta-analysis of all available, validated quality of life measures for individuals with IDD. I can share that because some of it really breaks down what are all the different measures, how long are they self-report, and these kinds of things. And also there are even some guidelines for how to determine what kind of measure is appropriate for the population of IDD that you serve, depending on ability level. And so I think it gets a little complicated, but it might be something good just to share for people to sit down and wade through that.
Okay. Ben asked a question, asking about would you deploy the surveys before implementing a program and then repeat, say, a survey intake over the course of the program? I think you touched on this a little bit after, and Jackie, you did too, kind of when
When, right.
you're
And Jackie,
gathering and how often.
exactly. And Jackie talked about this a little bit too. So yeah, I think your baseline needs to be as pure as it could be. So it could be before they start, or maybe like first day, first week, something really early. So it's a clean measure before there is any care farming. That's ideal. And then some follow-up period, which really depends on you and what you think is sufficient time to have made progress on whatever it is you're trying to measure. So it will vary for different farms. But the literature on care farming does sort of take, like Jackie said, these 3-month increments is pretty normal. Like 10 to 12 weeks is kind of the norm for the literature in Europe on care farming. So, I mean, that might be a start.
Okay. And I just wanted to highlight also a comment by Sean. Sean, you had talked a little bit about some of your research back at the conference in 2020, I guess this year, 2025. But I love that you had students there who were doing research, because you had talked about your use of testimonials and kind of that piece. But now, could you say something about how you connected with people? Because I think we hear a lot of that from care farms. You know, where do I go to find somebody who's already well versed in this field and we have a project?
Yeah, excuse me. So both of those connections kind of came organically, really just through talking about the work every chance we get, and people hear about what you're doing. And in both those situations, I wish I had like a trade secret, but both of those students approached us after hearing about the work and having one was seeking a degree in veterinary science, and the other was getting his PhD in psychology. So they were somewhat local to the area, heard about what we were doing, asked to come see the farm, take a tour, and it just kind of went from there. But those connections were really valuable for us because we didn't necessarily have the internal capacity to do some of these outcomes measurements, or at the time we didn't. So, and I love the idea of having an independent body come in and do the research for us, because we all see data come in all shapes and sizes, and when it's generated from an independent party, I think it's that much more valid sometimes. So it's tough because, like, as I read through the studies, sometimes they would use terminology we wouldn't use, or we kind of lose control over some of the messaging piece in a way, but it's okay in the long run. And since that time, we've had other universities reach out with interest of connecting their students with us. So it's something we hope to continue to do.
Thanks, Sean. I see Karma has also put some referral partners in. I know Andre and I often talk about the extension agents through a local university, encouraging people, if you haven't, to think about partnering. If you have a extension program at a local university, you've got people who are in agriculture, you've got people in health and human sectors. Oftentimes those are really good options if you have a project that you want partnership on. Ben, you had a question.
I just wanted to add on to that. I would just setting expectations, I guess. Extension is very different state to state, and as an organization that works over 3 states that are right next to each other, they all have very different availability and professional services they can offer. But I also think it's a great plug to make if you're involved in policies. Strengthening extension, it's a good use of tax dollars, at least from my perspective, and the farmers we work with. So anyways,
Thank you. Appreciate that. John, did you have a question?
Could I add something? I think it's also partnering with institutions is helpful, because if your farm doesn't have an IRB, those institutions will, and they're going to provide the resources to show that what you're doing has been reviewed, is ethical, right, and is being supported. And that's also going to definitely help with grants and help with the overall approach to research.
And really quick, I did just recently learned what an IRB is. Do you want to just define that for folks, because it's a thing to know?
Sure. So it stands for the Internal Review Board, and typically, Tony, I'm sure, could speak to this ad nauseum. But before one starts a research project, You present to a board of independent people who oversee your proposal. They read it, and then they make a decision about the whether it is ethical, whether certain protections have been made in order to ensure that the population that you want to work with and do research with is being protected in certain ways. And it's sort of it's standard for most researchers to get IRB approval before they start their project. And that's something that can be done if you're partnering with an institution.
And I just want to add, if you have already collected data and you're like, oh no, I didn't do an IRB, that's also okay. You can use previous data, you can publish your data, you know, in terms of your internal marketing and internal grant funding without necessarily doing an IRB. It's just when you do the IRB, it gives you those options for publishing and more robustness and those ethical review of the data and your research. So don't be afraid.
Karma, you had a last question in here about how can extension that do not want care farms be worked with? You want to, I'm not sure.
Yeah, agribusiness funded extensions, 101. You know, this is Monsanto in your university. Yeah, enough said. I don't know who I'm talking to. So I'm on the do not open email list with a number of agribusiness corporations in a number of states. So I don't want to make a long story of this, but I'm just saying that even at the board of trustees level, you get made fun of, you get anti-trauma informed narrative, you get donor relations questions, you get even questions about what the institutional review board's stake is. It gets, yeah, enough said.
Yeah.
Need board of trustees. You know, there is such a thing as the National Association for Trustees. Trustees associations are operated by attorneys in every state, and then all of those state attorneys, lobbyists, trustees go to a national meeting every year, and they have to have training. It's part of their role. And the board of trustees are trying to get paid salaries in more and more states, and we know where those salaries are coming from. And so
I do think that there are some real rainbows on the horizon.
yes, I don't want to be a downer. I just want.
No, and I'm not saying, I just think that, yeah, there are going to be, I think to Ben's point.
Well, these anecdotal stories that Jackie and Tony and Kara, everybody has these anecdotal stories. We need to take those to the Board of Trustees trainings, and here's the solution. If you want to do that, call me. I will help you make it happen in any state, because I've got that inside track of a couple of attorneys that run Board of Trustees associations that are saying, if you want to get it in front of us, we'll schedule you out 2 years from now, but we'll get you on the training. So there is a solution.
Well, we are coming right up at the end of the hour. And I just want to thank everybody for joining us today. And we really hope that this session helped make evaluation and tools just feel a little bit more approachable and inspiring. I threw this in the chat. It will go back out in the resource document that we're sharing out, but we do have an online resource library that's free to use. So please take a peek at that. We're always adding new resources. You will see some of the tools shared here today in that resource library. So that is for you, our members. And just one other thing is we invite you to consider joining us for the 2026 Care Farming Network National Conference. It is still quite a ways away, February 2026, but we're accepting proposals now for conference sessions. If you have an idea that you would like to share, maybe something on this topic or something different, you can find that on our website. We also have our open office hour, which is on Tuesday, August 19th at 10 a.m. Eastern, casual drop-in session where you can ask some questions, get guidance, or just chat with others. You can find that on our event page. And so just a big thank you to Tony, to Jackie, to Kara, and for all of you for sharing your knowledge, for showing up. And we really appreciate all that you have done and are doing for care farming. Have yourself a wonderful rest of the day, and we'll be sharing this out here soon.